Hello and welcome. Today, we're diving into a condition that affects blood flow, particularly in the extremities, Raynaud's disease. While it's not directly a heart disease, understanding its impact on blood vessels and circulation is crucial for overall cardiovascular health. So, what causes Raynaud's disease? The exact cause isn't always clear, especially in primary Raynaud's. However, it's believed to involve an overreaction of the sympathetic nervous system, the part of your nervous system that controls involuntary functions like blood pressure. This overreaction causes blood vessels in the fingers and toes to spasm. Secondary Raynaud's, on the other hand, has identifiable underlying causes like autoimmune diseases such as lupus, scleroderma, and rheumatoid arthritis. Other contributing factors include certain medications, smoking, injuries to the hands or feet, and even exposure to certain chemicals. Let's look at the pathophysiology. Normally, blood vessels constrict and dilate to regulate body temperature and blood flow. In Raynaud's, the small arteries in your fingers and toes experience vasospasm, meaning they suddenly narrow. This constriction dramatically reduces blood flow to the affected areas. When blood flow returns, it can cause throbbing pain, tingling, and swelling. Over time, repeated episodes of Raynaud's can damage the small arteries, leading to permanent changes in the blood vessels and potential tissue damage in severe cases. Raynaud's disease affects an estimated 3 to 5% of the population. It's more common in women than in men, and it typically appears between the ages of 15 and 30. People living in colder climates are also more likely to develop Raynaud's, as are those with a family history of the condition. It's important to note that the prevalence of secondary Raynaud's depends on the prevalence of the underlying conditions that cause it. The most recognizable signs and symptoms of Raynaud's disease involve color changes in the fingers or toes in response to cold or stress. Typically, the affected area turns white, then blue, and finally red as blood flow returns. These color changes are often accompanied by numbness, tingling, throbbing, and pain. Attacks can last from a few minutes to several hours. In severe cases, prolonged lack of blood flow can lead to skin ulcers or even tissue death, gangrene, but this is rare. Diagnosing Raynaud's disease usually involves a physical exam and a review of your medical history. A doctor may also perform a nail-fold capillaroscopy, a non-invasive test that examines the small blood vessels at the base of your fingernails under a microscope. This test can help differentiate between primary and secondary Raynaud's. Blood tests, such as an antinuclear antibody (NA) test, may also be ordered to check for underlying autoimmune diseases. Raynaud's disease is often classified as either primary or secondary. Primary Raynaud's, also known as Raynaud's disease, has no known underlying cause. It's often milder and doesn't cause significant complications. Secondary Raynaud's, also known as Raynaud's phenomenon, is caused by an underlying condition, such as an autoimmune disease, and is often more severe and can lead to complications. Treatment for Raynaud's disease focuses on managing symptoms and preventing attacks. Lifestyle changes are often the first line of defense. These include keeping your hands and feet warm, avoiding cold exposure, managing stress, and quitting smoking. Medications, such as calcium channel blockers, alpha blockers, and vasodilators, can help relax blood vessels and improve blood flow. In severe cases, surgery, such as sympathectomy, which involves cutting the nerves that control blood vessel constriction, may be considered, though this is rare. Preventing Raynaud's attacks primarily involves avoiding triggers. This includes dressing warmly in cold weather, wearing gloves or mittens, and avoiding sudden temperature changes. Managing stress through relaxation techniques like yoga or meditation can also be helpful. If you smoke, quitting is crucial, as nicotine constricts blood vessels. Additionally, reviewing your medications with your doctor to identify any potential triggers is important. The prognosis for primary Raynaud's disease is generally good, with most people able to manage their symptoms with lifestyle changes. Secondary Raynaud's has a more variable prognosis, depending on the underlying condition. Recent research is focusing on understanding the specific mechanisms that cause vasospasm in Raynaud's and developing more targeted therapies. For example, some studies are exploring the potential of gene therapy and stem cell therapy to improve blood vessel function. Also, research is continuing to better understand the role of the immune system in Raynaud's phenomenon and to identify new therapeutic targets for autoimmune-related Raynaud's. It is always important to discuss any health concerns with your doctor to discuss the best treatment plan.